I'm Tara Schwartz, and this is Health Matters. The world lost a remarkable woman this week. Dr. Sylvia Cruess lived an extraordinary life. She passed away at the age of 92 this week. Dr. Cruess was an endocrinologist. She was the first woman to be director of the Metabolic Day Center at the Royal Victoria Hospital. And in 1977, she was the first woman in Quebec and perhaps Canada to be appointed medical director of the Royal Victoria Hospital. She inspired and mentored countless women in their medical careers, including Dr. Joyce Pickering, director of the clinical teaching units at the RVH at the MUHC. She joins me now to discuss Dr. Cruess's incredible legacy. Thank you so much for being with us, Dr. Pickering.
It's a pleasure.
So when did you first meet Dr. Cruess?
I really don't remember because she's a little bit like Queen Elizabeth. She's been around as long as I can remember.
So take us back to some of the first moments you can remember with her.
So I would have been a medical student in the late 70s and might well have run into her in the endocrinology context. I probably more formally met her when I was a resident, so that would have been starting in about 1982 or 83.
And tell us a little bit about how your relationship developed and how you got to know her better and more personally.
Well, even when I met her, she was quite an important person. And, as a resident, I would have maybe felt a little bit nervous about being too personal with her. But what really struck me about her was how approachable and how practical she was. She wasn't afraid to call a spade, and was always looking for solutions to problems.
It's a really wonderful way to be, especially when you're in a position, of that she was able to hold medical director at the Royal Victoria Hospital. What was she like as a person? Can you give us any insight into who she was on a more personal level?
I think what I remember most about her was how practical she really was. She gave you straight answers to questions. It was never about her. It was always about addressing the issue and solving the problems. And she had a very broad perspective from having done both managerial work and also having been a clinician herself. So she sort of saw both sides of how the issues involved in running a healthcare system.
We're speaking with Dr. Joyce Pickering about the legacy of Dr. Sylvia Cruess, who passed away this week at the age of 92. I noted some of her incredible achievements when I was doing the introduction, but as a woman in medicine, what does Dr. Cruess's legacy mean to you?
I think what it means to me is her role in leadership. Even 30 or 40 years ago, there were plenty of women in medicine practicing clinical work and often very good at what they did, as was Dr. Cruess. But she had a leadership position. The Director of Professional Services is, in fact, if you like, the boss of all the doctors at the hospital. They report to her for their clinical responsibilities. So she had this leadership position, and that was more unusual, especially in that time for women.
Do you think that she understood how she was a trailblazer, either at that time or later?
That's a good question. I don't know the answer to that. She was such a practical person. It was just about doing what needed to be done and moving on to the next thing. I suspect she didn't sort of stop and think a lot about how significant her role was, but I never asked her that question.
So let's talk about what other people might think of it. What impact do you think her achievements or career will have on generations of women who were working with her, alongside her, or maybe a few years behind her, as well as the ones that, are coming up, the future generations?
Well, just to give you an example, we recently had the Director of Professional Services for the MUHC, Dr. Eva Sidorowicz, retired after, I don't remember exactly, but probably 10 years or more working. So that's a sort of a direct descendant, if you like, because that's the role that Dr. Cruess had. We have another woman, Dr. Lamar, who's the current Director of Professional Services for the MUHC. So you can see that her role has perhaps led to many women feeling that that's an appropriate role for them to take in the hospital management.
Yes, I think it does, and I feel on some level she must have known what she was giving to the rest of the world in terms of helping women to move up in the world, like you said, to administrative roles, which we certainly need more of. Do you have a favorite memory or interaction with her that you can share?
I interacted with her many times, but the one that I remember that came to mind, and that was actually very early on, is she was, as you mentioned earlier, endocrinologist. She was the director of the Metabolic Day Center. She worked there, and of course, in the day center, you would take care of many diabetic patients. It's important to be able to examine their eyes. And she told me that in the Metabolic Day Center, in the office where she had to examine patients, she could not turn off the lights, so she couldn't examine the eyes properly. And she looked at me and said, "You would have thought that when they were designing a clinic for diabetic doctors, they would have allowed you to turn off the lights." I thought, she's right. They definitely
Right,
should have thought of that. So that was
as
an
you mentioned,
example
the,
of
the
her. Yeah,
practicality. Yeah,
yeah, very
as you
practical. Call
mentioned.
a spade a spade. You know. Yeah.
Wonderful. We're talking with Dr. Joyce Pickering about the legacy of Dr. Sylvia Cruess, a trailblazer in women's health and administrative roles. She passed away this week at the age of 92. What was your reaction, Dr. Pickering, when you found out that Dr. Cruess had passed away?
I really felt like it was the end of an era, you know. I
Hmm.
mean, I think a lot of us have been talking about the end of an era with the passing of Queen Elizabeth. And it's, I mean, obviously on a much smaller scale, but it's that kind of thing. She's been there as long as I can remember. I should just mention that after her role as Director of Professional Services, she went on to have yet another very important career in teaching and research and professionalism, which was also important. But she's just been part of the medical faculty at McGill for as long as I can remember, and probably as long as many people can remember. And not only was she a part of it, she was a leader in it and taught and influenced many people. So that's really what I thought. Wow, that's the end of an era.
Yeah, I think that sums it up well. What about her legacy? I mean, you touched on it a bit in your previous answer, but what becomes the legacy of Dr. Sylvia Cruess? Aside from, she had a beautiful, she was married to her husband, Dr. Richard Cruess, for 71 years. She had children and grandchildren and great grandchildren. But her legacy on a professional level, what do you see that as being?
Well, two areas, I would say. The first area we've kind of talked about, her role in medical administration and leadership in medical administration. And the second is what she really moved into in the last 25 years, which was her role in research and teaching and professionalism. And she, together with her husband, Dr. Richard Cruess, have had a huge impact on the training of all the physicians who go through McGill in terms of explicitly teaching about professionalism, helping us think about how to better evaluate professionalism, how to remediate issues when they happen. They've created a name for themselves and for McGill in the area of professionalism in the last roughly 25 years that they've worked. So that's another very big legacy. And, when you've had an impact of the medical curriculum, that means you've impacted all the medical students who've gone through McGill. And over the years, we're talking thousands.
If you were going to describe her to a younger woman who maybe doesn't realize, the kind of trailblazing Dr. Cruess did, and that maybe, part of what a part this one young medical student is living is partly because of, how Dr. Cruess, paved so many roads. How would you describe Dr. Cruess to a young female medical healthcare practitioner just starting out her career?
Um, I would say that one of the things about Dr. Cruess, Dr. Sylvia Cruess, was that she cared more about solving the problem and getting something done than she did about who got the credit for it.
Mm.
And that is something that's hard for a lot of people to do, but she was able to do it. And I hope that can be a model for many people as they work in medicine, and of course in many walks of life. That sort of general principle would be true.
That is a lovely thought to end on. And I think that is beautiful. And I hope it does touch a lot of people. She was an extraordinary woman. Dr. Sylvia Cruess passed away at the age of 92 this week. Dr. Joyce Pickering, thank you for giving us a few moments of your time and sharing some wonderful memories with a really incredible person. Thank you so much for your time today.
You're very welcome.